Sherry? Okay, I'm not hearing her, so we'll continue on. There's a number 202-679-8646. There's not a name there, but if you could let us know who you are.
Hi, Colleen. Colleen, this is Paul.
Oh, hey, Paul. Okay, cool, great. I'm glad that you're able to join. Can you just quickly introduce yourself, and we'll talk a little bit. We'll hear more from you later as well.
Sure, absolutely. This is Paul Bonta. I am the Director of Government Relations for the Safe States Alliance.
Yeah. Thanks, Paul. And then the next number I have is 402-471-0379.
Hi, this is Felicia Quintana-Zen with Nebraska DHHS.
Hi, Felicia.
I'm an EPI here.
Okay. And do you have any role in any policy work?
Not a huge role.
Okay. And then the next number I have is 770-488-7388. I think that's an Atlanta number. Maybe
that would be Jamie Mills.
Okay. Awesome.
Hi, I'm Jamie Mills. I am a project officer here at the Injury Center. I serve as the project officer for Colorado and Nebraska and for this region. I don't have any direct policy work, but we do kind of funnel, of course, things that are happening at the state level up to our policy leads.
Excellent. Thanks, Jamie. And then the next number I have is 785-296-1223.
Yep, that's Sherry Sage. Sorry, I think I'm showing up on the screen. I was logging into the, I couldn't get my computer audio to work. So, but I'm Sherry Sage. I'm with the Kansas Department of Health and Environment and the Bureau of Health Promotion, and my role is the State Director for Safe Kids Kansas. So while I'm a state employee federally funded, I don't get involved directly in the policy. However, the Safe Kids Coalition does have a full policy platform and priorities.
Okay, great, thanks for sharing. And then the next one, it looks like another Kansas number, 296-8163. My screen is really small.
Hi, this is Lori Haskett with the Kansas Department of Health and Environment. Injury and Violence Prevention, Injury and Violence Prevention Program. And I would say my role is very similar to Colleen's in that I watch what's happening at our capital across the way here, and we provide bill reviews to our administration, and then if needed, we write testimony that is either submitted as written only or oral testimony occasionally.
Okay, thanks. Next, I have 801-538-4911.
Hi, it's Anna Fondario from Utah Department of Health.
Anna.
Hi, so I'm the program manager for the Violence and Injury Prevention Program, and my role in policy work has been, we track our legislation. I also will do fiscal impact analyses on some bills, and then also participate on several policy committees throughout the state. I will also do bill reviews and have provided some oral testimony as well.
Great, thank you for sharing. And we will also hear a little bit more from Anna a little bit later today because she's also a Safe States Policy Fellow.
Great, thanks.
And then Jamin, could you introduce yourself?
Yes, so I'm Jamin Johnson. I'm with the Wyoming Department of Health in the Injury and Violence Prevention Program, and I'm a program coordinator. And our role, we track bills and do bill reviews, so sort of a limited role.
Okay, thanks. And then next I have Lindsay Myers.
Hi everyone, I'm Lindsay Myers. I'm the grant for the Violence.
You're kind of quiet, Lindsay.
Well, that's because I'm trying to.
Lindsay, you're muted now, it looks like.
Is that better?
Yes.
Okay.
sorry, lesson learned, you have to have your computer open in order to have the microphone work. So I'm Lindsay Myers. I'm the branch chief for the Violence and Injury Prevention Mental Health Promotion branch in Colorado and work with Colleen. Similar to what others have said, particularly Lori, my role is to work on policy in a variety of different ways, weighing in on bill analyses and fiscal notes and making recommendations through our internal process here at the department to try to drive policies that we feel are important to get on the legislative agendas for our departments. I actually thought I wasn't able to be here today because I was supposed to be testifying on an opioid bill this afternoon, but also a good lesson learned, always make sure they didn't move it at the last minute and you didn't know. So I was glad I actually looked before I headed to the Capitol, but that's some of the ways I'm involved.
Thanks. And then next, Mandy.
Hi, everybody. Mandy Slegg, North Dakota Department of Health. As far as policy, I guess variety of ways, just depending on what bill it is. We do tracking of the bill, which is following the bill, and then monitoring the bill, which is following the bill, tracking the bill, which is attending the hearing and to be an expert to answer questions on the bill, and then I have testified as well.
Great, thanks for sharing. Sally, could you introduce yourself? Sally? I think Sally is a Sally from CDC, so if you're on mute, we can't hear you. Okay. I will move on. So Tiffany Conroy?
Yep, I'm here. Can you hear me? I'm using a new headset.
Yeah, we can hear you.
Okay, great. I'm Tiffany Conroy. I'm the Violence Prevention Coordinator at the Iowa Department of Public Health. And really similar to what a lot of other people have said in terms of kind of my specific work, it's related to looking at when our legislators put something up that is related to the work that I do. I'll look at doing a fiscal assessment or a legislative assessment for that. So kind of really similar to what a lot of people have already said.
Great, thanks for sharing. And then the last person I think I have on my list, but chime in if I missed anybody, is Sarah. You could introduce yourself.
Yes, this is Sarah Earhart-Reed with Missouri Department of Health and Senior Services. I'm the Deputy Chief in our Office of Women's Health, which means that I also do our rape prevention education work. Our policy role is pretty limited. We provide fiscal notes on bills that directly impact our office, but otherwise we don't have much of a role in policy work.
Okay. Did I miss anybody in introductions? I was going through my participant list, but it's possible that I missed someone. All right. Well, thanks everybody for introducing yourself and for joining the call today. It's great to hear from members across the states and our regions. And it's also great to hear some of the different roles that you all play in policy. And I'm hoping that out of that, we can have a good discussion later in the call just to talk about, what we've done and haven't done in it. And since a lot of us hold similar roles, hopefully there's some lessons that we can learn from each other as well. So for today, there are a few things that that we were going to cover prior to the more open discussion. The first is that when I was working with the advisory team to prep for this call, we talked about that it might be helpful to lay out what the timelines for our state legislative sessions are for all the states in our region. So I had I just pulled these dates from research and various tips that I was doing online, and so hopefully I got them all correct. But you can see, from this list that most of our states are currently in legislative session, which is why this call in January is so timely. There are a few states that don't have sessions this year, that they meet every other year, and then Wyoming is in a budget session this year, but the legislature actually meets annually anyway. Is there any, like, are there any glaring mistakes that anybody notices just looking quickly at your states in this list? Okay. So hearing nothing, hopefully, you know, for the, was someone going to say something?
Oh, sorry, this is Felicia from Nebraska.
Okay, go ahead.
Every other year we have a short and then a long session.
Oh, okay.
So that timeline will be a little bit different annually.
Okay.
And I can send that to you or give you kind of an idea of what that is.
Yeah, that would be great. I just thought it would be helpful for us all to have this information and are aware of it, and maybe on an annual basis what we can do is post it on our website as well. So if something isn't correct, let me know. And Felicia, is this year the longer session then? Is that are the dates at least for 2018, right?
No, this year we're in a short session.
Okay. All right.
So, and I don't remember when it ends, but next year is our long session. So
okay.
I'll get those both for you.
Okay, thanks. Great.
Colleen, this is Mandy. I think I misspoke to you when I told you. We actually have like interim committee work in the even years. So.
Oh, okay. All right.
Yeah.
All right. That's good to know. Okay. Well, again, you know, hopefully since many of our states are in session, we can talk a little bit about what is currently coming up each year, or for this year, sorry, and talk and just, you know, just some general sharing on what to be aware of for this current legislative session. Hi, Lisa, I see that you joined.
Sorry, I was running late today with another call, so.
I just saw your face pop up. So then as an advisory team, we also talked about highlighting some policy resources that are actually available from Safe States Alliance. So as many of you may know, Safe States is a member organization, a national member organization that provides resources, training, and tools, and as well as some policy advocacy work for the field of injury and violence prevention. And I have the pleasure of serving as the policy committee chair for Safe States. And so out of that work, this is a good opportunity for me to learn a little bit more about all the resources that they have. And then because we have two policy fellows, Safe States policy fellows housed here within our regions, Anne and Anna are going to talk a little bit about that experience. And Paul Bonta, who is the government relations lead at Safe States, will also provide us with some updates and talk a little bit about his role there. So just quickly running through this list, if you are, and part of the reason for sharing these resources is that as a regional network, as we talked about, you know, some of our needs and what we're interested in learning more about, I think it's also important for us to consider what else is already available and out there for us as injury and violence prevention practitioners and researchers. So Safe States is one resource, and then we'll talk a little bit later on our plans for our February call, which is when we'll learn a little bit about some other national resources that exist. So the first one is just Safe States has various online trainings. They have a whole training center portal that you can search for various trainings by keyword, and if you just plug in the word policy, a whole list comes up, and they're often pre-recorded trainings that you can usually get learning credits for. So if you're certified in public health, or you're a certified health education specialist, you can actually use the trainings that Safe States has in their training center to use towards your recertification credits. So that may be a really helpful tool. The second thing on the list is that Safe States has customizable tools and templates to use if you're ever meeting with your elected officials or representatives. So in order to educate them on the work and priority areas that you have, these are geared for, I would say, for our national representatives. And so, for example, you'll see, I pulled just a screenshot here of some of the available ones, but there's one on an overview of the core state violence and injury prevention program, and they're customizable, so you can put more specific information if you're funded for core around the program area or the program work that you're doing in your state. And the same goes for the National Violent Death Reporting System. So if you have NVDRS in your state and would like to share information and education with elected officials about what NVDRS is and how your state uses it, you can use those customizable tools and templates from Safe States. The state profile templates are also customizable, and it's just an opportunity for you. There's some blank spaces in there around information that might be helpful to use when educating representatives about work that we do in injury and violence prevention. And then the third bullet there is a comprehensive congressional outreach guide that Safe States created, and maybe I linked to it, but it doesn't look like I did. But you can find the links on their policy homepage, which is the link at the top of the page. Again, this is more geared towards the congressional outreach for our elected officials in Congress, but at the national level. But some of the tools and tips in there may also be helpful if you're ever meeting with elected officials at the state level as well. And then Safe States also has quite a few policy and position statements on a variety of injury and violence prevention topics. So you can find those all at their website on the link that's listed there. But as you can see, they have position and policy statements on a variety of issues related to a lot of the work that we do at the state level as well. And these have recommended best practice policies and programs to prevent injuries and violence related to these various topic areas. So those may be worth taking a look at. So another policy-related role of Safe States is to convene and lead the Injury and Violence Prevention Network, which is a group or network or coalition of national organizations that support injury and violence prevention policies at the national level and really advocates for federal funding for injury and violence prevention. This is a network that Paul leads, so if you have anything to add to that, I just threw it in there, but it's a group of organizations that align their efforts in order to support the work that we do on the ground here at the state level. And then, as I mentioned, I co-chair the Safe States Policy Committee, and the role of that committee is, and actually we're working on what we're developing in 2018. So if you're interested in doing more policy work, something that we are going to work on is developing a toolkit and some guidance for practitioners to use at the state level. So engaging in state level policy work, so inclusive of figuring out how to come up with legislative trackers to track policy during your legislative session, or how you may be able to engage in policy work, not just at the national level through Safe States, but also at the state level to educate policymakers in the work that we do. And then Paul, if you wouldn't mind talking a little bit about what your role is at Safe States, and then something that is something that Paul often does for us at the policy committee at Safe States is providing updates on the national landscape. So I thought that might be helpful for us to hear as a network as well.
Sure, thanks, Colleen. So as Colleen mentioned, I'm the Director of Government Relations for the Safe States Alliance. I also am currently, directing the National Violence Prevention Network. The Injury and Violence Prevention Network, which, as Colleen mentioned, is really a national organization, a national coalition, I should say, of organizations that have an interest in advancing injury and violence prevention policy. So my role at Safe States is a role that I think is really twofold. On the one hand, my job is really to keep Safe States members informed and up to date with regards to what's going on primarily on Capitol Hill, but also from time to time at the state level. So primarily what's going on with national injury and violence prevention policy. So what legislation might be moving through the process that we might have an interest in, or what opportunities might exist for us to promote or advance national policy that we have an interest in. And then in addition to that, my role is also to kind of act as a liaison or intermediary between Safe States members and the legislative process. So from time to time, when there are opportunities to engage in the legislative process, when there are opportunities to exercise the voice of the injury and violence prevention community, my role is really to reach out to Safe States members and encourage them to engage in the process, explain to them what the current opportunity is about and why it's imperative for Safe States members to contact their representatives or their senators to express a particular opinion, either about an issue that might be ripe at the moment or a piece of legislation that may be moving through the process. In addition to that, as Colleen said, I provide government relations updates to the policy committee, to the Injury and Violence Prevention Network at our annual meeting. So whenever there's a need for an update in terms of what's happening with injury and violence prevention legislation, I'm always more than happy to provide those updates across various different venues. So Colleen, did you want me to give a quick update in terms of what's happening right now?
Sure, I think that would be helpful for us to hear.
So I think many of you have probably heard the big news of today, and that is that the CDC director, Brenda Fitzgerald, has resigned. That was news that I think some of us were expecting, given the increased pressures on Dr. Fitzgerald to not only divest her investments, to divest some of her divestments, but also given the news that broke yesterday regarding her purchase of stock in tobacco companies. I think the pressure had been mounting now for the past couple of weeks, and the news that broke yesterday was kind of the last straw on the camel's back that really forced her resignation early today. Obviously, that is something that perhaps does not have a direct impact on the legislative process. However, the good news, bad news here is Safe States has been closely monitoring an effort that's been underway in Congress to allocate more dollars towards the opioid epidemic. And so we organized a sign-on letter that went up to members of Congress on behalf of the Injury and Violence Prevention Network, urging appropriators to recognize the need to fund opioid prevention programs when they seek to allocate new dollars to address the opioid epidemic. One of the things that we've seen with previous allocations of federal dollars towards the opioid epidemic is that by and large, those were dollars that were allocated towards opioid treatment programs. And so as I said, we organized a sign-on letter that went up to the Hill, urging lawmakers to recognize the importance of opioid prevention programs. And so we sent that letter up late December, and I'll share with you all that it's been a challenge in follow-up discussions I've had with congressional offices. The challenge being that there have been senior appropriators in Congress who have perhaps not fully embraced the notion that opioid prevention dollars should be allocated to CDC, primarily because of the controversy surrounding Dr. Fitzgerald. There are some who have been frustrated that Dr. Fitzgerald has been unable to testify in person on Capitol Hill. And so as a result, they have shied away from actively working to allocate more dollars, perhaps to the CDC Injury Center. to address the opioid epidemic. So now that Dr. Fitzgerald has stepped down, hopefully that concern or hopefully that challenge has been removed. Obviously, we will now have to wait and see who is nominated to replace Dr. Fitzgerald. I spoke to somebody yesterday at the White House who let me know that they had actually received a communication from the White House Chief of Staff's office seeking names of potential candidates who might be considered for that CDC director slot. Obviously, this is something that the new director of the Department of Health and Human Services, Alex Azar, will be leading, but it seems apparent that it's not only an effort that the leadership at HHS will pursue, but senior White House officials are also engaged in that as well. I can't tell you right now who's on the short list. I really don't know. My sense is that there's probably a long list of candidates that will likely be whittled down in the days and weeks ahead. And all I know is that this is a priority for the White House and for the new Secretary of HHS. And so I expect that there will be a new director named fairly shortly. The only other quick thing I'll mention is, as all of you know, government agencies are currently operating under a continuing resolution that will expire towards the end of next week. And so Congress will have to come together next week to try to negotiate another continuing resolution that will allow government agencies to continue operating at their currently funded levels beyond next Thursday, as everybody recognizes that there just simply isn't enough time between now and next Thursday to finalize the fiscal year 2018 budgets for all federal agencies. So Congress will need to pass another continuing resolution at the end of next week to buy themselves more time so that they can hopefully finalize negotiations on fiscal year 2018 funding levels. So with that, Colleen, I'll turn it back over to you and happy to answer any questions.
Thanks so much, Paul. Did anybody have any questions for Paul? We have him on the phone. Okay, hearing none, that's fine. I will just put a plug if you are a member of Safe States Alliance and you're interested in getting involved in the policy committee. It's open to members. Paul provides similar updates on a quarterly basis to that committee. And then as a member, they also send, or as an organization, they send out member newsletters on, I believe it's a monthly basis. And there's usually a little government relations highlight from Paul that's written up and shared in those as well. So great resource to connect and think about how our work is influenced by Congress and the national level as well. And the next thing,
Colleen, can I just mention,
oh yeah, go ahead.
Can I just quickly mention one more thing?
Sure.
And I know that this call is focused mostly at the state level, but I'll also share with everyone that we've heard from various Safe States members, we've heard from members of the policy committee that they need more, they want more resources that are aimed at state level advocacy and state level policy initiatives. And so I think that is something that Safe States will be moving towards in the months and years ahead. So you can probably expect to see more resources for all of you who are engaged specifically at the state level. And I'll also just quickly mention that for those of you who are working for health departments, many of you on the phone noted that you're engaged in the state legislative policymaking process, and that is fantastic. And I recognize that many of you are required to really promote and advance the interests of your department. You're required to really promote the interest of your governor's office. But I think it's also important to note that many of you have an opportunity, all of you really have an opportunity to educate lawmakers about injury and violence prevention policy on your own time. So you have an opportunity to either communicate with lawmakers from your home email account, visit with lawmakers on your own time. The benefit of that really is when you do it on your own time, and all of you are injury and violence prevention professionals, when you do it on your own time, you're really freed from any of the filters that many of you experience in your professional lives. And so again, as injury and violence professionals, you all, I think, are uniquely positioned to offer your expertise to lawmakers and to do so on your own time without the shackles or without the filters that are imposed on many of you in your day-to-day job. The last thing I'll mention about my role is that, what I aim to do is to make member engagement in the legislative process as easy as possible. So for any of you that have any questions about how to engage in state policy making, or if you need assistance, or if you need materials, if you need handouts, please don't hesitate to reach out and contact me, because again, my job, a big focus of my job, is to just facilitate this engagement for Safe States members. Thanks, Colleen.
Thank you, that's great. And I failed to put Paul's contact information on the slide, but I'm happy to share that following the meeting, and I'm sure it's available on the Safe States website. So, so next, just something that is new for Safe States, and I think aligned with how Safe States members and individuals can engage in policy at the state and national levels, is this Safe States Policy Fellowship. And I'm actually going to turn the next few slides over to Ann Saba from Iowa and Anna Fundario from Utah, who are two of the four, I think there are four total now, Safe States Policy Fellows, to talk a little bit about what the fellowship includes and what their experiences have been thus far. And I think we're lucky that the states and our regions are well represented through the Policy Fellowship with Ann and Anna sitting on it. So I can drive the slides, Ann and Anna, and if you don't mind unmuting yourselves, I'm not sure who's up first, so I'll let you guys sort that out.
Hi, it's Anna from Utah. I believe I'm up first, so if you want to advance to the next slide, that would be great. Sure. So for this fellowship, we've only met twice. We've had 2 conference calls, and in each of those calls, we've had different assignments. So I'll talk about our first assignment and the experiences. I'll share some of my experiences with that, and then Ann will talk about the second assignment. And then we're meeting again on Monday to kind of go through our third assignment. And then, of course, we're all attending, or I'm assuming we're all attending, the Hill Day on March 22nd. So, so far with our first assignment, we were charged to get to know our members of Congress. And our goal, the overall goal, I think, for this policy fellowship is to have us develop relationships with our elected officials and the staff of those elected officials. And as I was mentioning, our first assignment was to research and get to know who our members of Congress were on the federal or on the national level. And so the next slide will kind of talk about what we were charged with finding out. But one of the other things that we talked about in our first call was having at least 5 touch points throughout the year with our representatives. And this could include face-to-face meetings, reaching out via email, and you could do that by alerting them to a new report you might have, legislative briefs, or an important injury topic. But really the goal is to just get to know them, and that way if things were to come up, or if they were interested in a certain topic, they're familiar with who you are, and you have that rapport that you've built with them, and they're more than likely to reach out to you and bring you to the table to provide any materials or data, or provide any education. And so we were charged with filling out a worksheet, and if you go to the next slide, I have listed some of the things we had to fill out in that worksheet. And it was a pretty simple assignment, but it was really helpful to be able to add more context to who our members of Congress were, their legislative history, and just their overall background information. That was really helpful for me to do some of that research. And some of that could be done. We looked at their website, just Googled information. So one of the interesting things that I learned regarding the committees, we had to go through and find out which committees our representatives or senators sat in on and or were chair of. And that was really interesting because even though they might not be on a committee that is health related, they might be on that committee with someone who is on a health related committee, and just knowing who they're working with and having contact with is really important because, you know, they'll talk on the Hill about different issues, and if they're familiar with your violence and injury issues, there could be an opportunity where something might come up and they'll be able to provide that information or say, oh yeah, I heard about that from my state. I know that's an important issue in my state. And so there's opportunities for that sort of discussion, which is something I hadn't thought about. And so I thought that was a pretty interesting thing to learn so far for this fellowship with that first assignment. The other thing that was interesting is just really understanding when they were first elected, because in Utah we have legislators who, one of them was elected in 1977, which is before I was born. And so just to know that they've been on the Hill for quite a long period of time, I think is really important to just understand their history and their longevity on the Hill, and just the different issues that they have voted on, just their history of being out there. So I thought that was kind of interesting to be able to look at that. And even their occupations prior to Congress, found out that one of my representatives was a high school teacher. And for some reason that was really interesting to me. The others were attorneys, but just being a high school teacher, I thought, to me, it made me feel like they were, I guess the way to describe it is just that they were like real people with previous jobs and occupations, and they do have interests and they do have priorities, and you know, just having those different experiences, I think, just put a little bit more context into just as legislators, you know, at the federal level. And actually one of them was a debate coach in high school. So I thought that was just kind of interesting as well. So, and then the other information that's on here, just knowing their previous education, dates of birth, where their addresses, where they're located on Capitol Hill, and then even here in our state, because not all of them will have their main offices in the same area. So just knowing where they're physically located was helpful. And then, of course, knowing who their legislative assistants are on healthcare issues. And so with this exercise, I know exactly who to contact, where they're located. And so as we develop different reports, I feel a little bit better with just reaching out and saying, hi, you know, I'm from the Violence and Injury Prevention Program at the Utah Department of Health, and we've just released this new report. If you're, you know, and just kind of reach out and have those touch points. So this was kind of a pretty basic assignment, but I think just understanding that background and context of our congressmen and knowing what their connections are, and then having a goal to reach out to them periodically throughout the year, I think is really important, something that I hadn't really thought about prior to this. So that's just the kind of the first assignment, and Anne will talk about our second assignment. And I don't know if you have anything you want to add, Anne or Paul.
Yeah, thanks, Anna. That was great. Can everyone hear me? Yeah, okay. So I'm going to do this in a little bit of a different order. I'm going to first talk about my priorities, my policy priorities as a policy fellow, and then talk about our second lesson with Paul about developing your priorities. So each of the policy fellows is picking a state priority and a federal priority to present to their legislators on Safe States Hill Day in DC on March 22nd. So my state priority is opioids. Last April, our center gathered about 38 stakeholders from around the state to identify priorities for addressing the prescription opioid crisis in Iowa. And the top 5 priorities or recommendations that came out of this meeting were highlighted in a report that our center released in October. So these are just a list of some of the recommendations. More physician training at the point of medical education, educate practitioners on recognizing high-risk patients, reduce barriers to using Iowa's prescription monitoring program, strengthen surveillance, and ensure that insurers are adequately covering medication-assisted treatment. And I just put a link to our report for anyone who's interested in reading more about it. You can go to the next slide, Colleen. So my federal priority is to expand funding for injury control research centers. So we are one of 10 ICRCs funded by the National Center for Injury Prevention and Control at the CDC. So despite the growing need for injury prevention efforts in the US, funding for ICRCs has decreased. And resulting in fewer centers and less funding per center. So actually recently, ICRCs came up with an ask together and are asking for $12 million for fiscal year 2019, which is 12 centers. Okay, next slide, please. Okay, so this was our lesson with Paul. So during one of our meetings with Paul, we went over how to develop our priorities. So these are a list of questions that can help you develop your priorities that you would present to your legislator. So these are some questions to help you. What is your ask, or what do you want the lawmaker to do? And this shouldn't be too specific, but also not too broad so that the legislator doesn't have to guess what your ask is. What is happening in your state or community that signals the need for this action? If action is taken, what would be the outcome? And what would be the impact of action in the community where you live? And then I just put a few of the lessons that I got out of this, which is to focus on getting your message right first and then worry about length later. That state lawmakers want to know about funding that goes to their state and want federal dollars. And then to show the success of your organization, hone in on specific programs and their impacts. So for me, this last point was really helpful just because in the beginning, as I was developing priorities, I was focusing on the burden of injury in general and the ICRC program as a whole, 10 centers, and Paul encouraged me to focus to kind of hone in and focus specifically more on Iowa and the impact of our center and the specific programs in Iowa because I'm talking to my Iowa representative. So it really got me to think more locally and be more specific. And then as far as the next step, I believe, and you can correct me, Paul, if anything I said is also incorrect, I think we're going to continue to develop our priorities into an elevator speech. I think that's the next step. And actually, we're meeting, I believe, next week. And that is it for me.
Great. Thank you so much, Anne and Anna. I wanted to just put out there if anybody has any questions about either any of the Safe States resources, any questions for Paul, or any questions about the policy fellowship for Anne and Anna. And maybe some of what they shared or the lessons learned or worksheets and tools might be helpful for us, other people that are engaged in policy as well. Any questions? Okay. Well, thank you again to all three of you for participating and helping to present on the fellowship and Safe States resources. Since I know that you're only partway through the year-long fellowship, it would be you could share ongoing updates on our future learning opportunities and other things that you've learned, especially as we continue conversations about our policy work. I think that would be really helpful.
Hey, Colleen?
Yes.
Hey, this is Paul. Just one quick point I wanted to make,
sure.
and that is that across all the various different policy fellows, they have all selected their own policy priorities, and it's actually been interesting to see that there's a great mix of state priorities and federal priorities. The policy fellowship is directed only at the national level or only at the state level. It's really a mix of both levels.
Is there any way that we could get maybe a list of what those priority areas are? Because I think part of the value of the regional network coordinating organizations and the regional networks is learning from each other and doing that and doing some peer learning. And so even if the fellows outside of our states, it may be an opportunity to reach out to them and to discuss what their priorities are and maybe do some cross learning around that.
Yeah, sure. I'd be happy to share with you. I can send you an email, Colleen, of the different priorities that the fellows selected.
Okay, that might be helpful for us to know, and everybody here. Thanks for sharing that.
Colleen, this is Lisa at the University of Iowa, and this is more of just a general comment. Just wanted to toss this out there as well. But as Paul was mentioning, Safe States has a day on the Hill coming up March 22nd. The ICRCs, the Injury Control Research Centers, are also working with CDC to have a congressional briefing on Tuesday, February 27th from 11:30 to 1 p.m., which we too are focusing because of opioids being such a hot topic right now. Having this briefing centered around addressing the opioid epidemic, leveraging partnerships, research, and practice, because I think we want them to hear the impact that research has on practice and get the link between the two, because we see these, research and practice working hand in hand. So I just wanted to throw that out there as another opportunity or another, I guess another opportunity to just highlight the great work that both the research and practice communities are doing.
Thanks for sharing that, Lisa. And if there's any information about that you want me to share with the larger network, I'd be happy to do that or post something on our website as well, if there's a way to get involved or listen or participate in some way.
Yeah, that's fantastic. I appreciate it. The other quick reminder that I'll have is we have those policy kind of templates, and maybe we'll talk about that again, but I know Anne has been working to develop an ATV safety policy. I don't know what we're calling them, like a kind of a policy brief that kind of came out of our face-to-face meeting. And so as soon as we have that finalized, we'll share that, because that too is very similar to the Safe States kind of fill-in template where you can add your own state's information. So we've gathered some general information about ATV safety and its impact. And then if I know in Iowa, it's been a pretty significant issue. We seem to have every year we have some sort of proposal to our legislators about putting them on the roadways and things like that. And I know it was specific Colorado. I think somebody from the Children's Hospital has asked us to develop it. So it's in development, and we'll roll that out here maybe in the next month or so.
Okay, yeah, that would be great to share with us. It would be really nice to see some additional examples of how those policy templates are being used.
Great.
And I know that we may be able to use that for some of the work we're doing in Colorado too, around our annual legislative reports.
Great, thank you.
Yeah, thanks for sharing that. So we're getting a little bit towards the end of our time, but I did want to open up to the entire group to share if there's any if there are any policy topics that you anticipate coming up or that have already come up in your 2018 legislative sessions, and then we can always talk more about these other successes and challenges on our next call as well. Anything anybody wants to share?
This is Peg in Nebraska.
Okay.
Hey, I'll just say that we had I guess we'd call it an early success. Our helmet repeal, which comes up annually, I mean, every single year, got stopped pretty early. One of the senators prioritized it, so it was heard on the floor really early, like the second week of the session. And they needed 33 votes to overcome the filibuster, and they only had 30. So we get to spend the rest of our session not worrying about it this year. So that's kind of nice.
Great, thanks for
And
sharing.
unfortunately, there were some bills that were introduced to improve our seatbelt law, but they probably won't go anywhere at all.
Yeah, to that end, I can share an update from Colorado about our primary seatbelt law that was introduced early in the session, and there was a committee hearing last week, and it was postponed indefinitely. So we won't be working and educating on primary seatbelt for the rest of the session, unfortunately.
This is Lori. I got an interesting invitation yesterday. It is a discussion about the opioid crisis in Kansas in our Health and Human Services committee of the House in our legislature tomorrow afternoon. And it doesn't say who's invited. I mean, I know through my agency who's invited, but in the legislative calendar, that's the line. The meeting's at 3:30 tomorrow afternoon. And, you know, typically there's more information in a legislative calendar, but it will be, and I guess the politics in Kansas are changing. So it probably is just a conversation about what's going on because I don't know if you know, we have a new governor today. Brownback was selected by President Trump to be nominated for a religious freedom ambassadorship, and that's probably not the correct title. And so we have a new governor, we have a new secretary of our agency, and we have a new director of health of our agency. So they are all invited to this meeting tomorrow, along with our deputy director, myself, and another bureau director will be there. So I look forward to seeing what our legislature is interested in.
Thanks. Yeah, and I would say that if anything comes up and there's a need for support, and this is true across everybody across the membership, if there's any needs, I'm happy to make connections with others in our network that have dealt with similar issues. So.
Well, if you have any specific, you know, I have the Arizona document that was just released by their governor's office. I did reach out to our project office, our DDPI project officer, because our new director of health asked for information, and I've sent him everything. Our new director of health, everything that our project officer sent, and off the top of my head right now, I can't think of what those were, but they were good documents. But if you have, they were very general. They came from CDC policy office. So if you have anything specific to prescription drug and legislative bills in other states, I think that would be beneficial for our new director of health. Is a previous, he was an attorney. He is an attorney. He is a physician. He was a previous legislator. He was previous law enforcement in Colorado. So he's pretty knowledgeable.
Okay. So if anybody has anything that they would like to share with Lori, you can either send it directly to her if you have her contact, or I can, if you send it to me, reply to the email that I sent out with a reminder. I'm happy to share that with her as well. And we may have stuff in Colorado too that we can share with you, Lori. Okay. So yeah, you're welcome. Thank you for sharing that. Just for the interest of time, I'm gonna unfortunately wrap up our very brief discussion and go over a couple next steps and just wrap up. So just as a reminder, if you haven't filled out the Plains to Peaks member inventory survey, we did decide to keep that open so we can collect responses on a rolling basis. So if you're new to the network or you didn't get a chance to fill it out previously, the link is there, and we'll keep that open and available and track responses on a rolling basis. And then I also wanted to remind folks, if you haven't already signed up for email updates with our Plains to Peaks Network blog collaboration site, the way that you do that is by entering your email address on the right-hand side of the page, and then click submit. And then you will be prompted for verification of your email to make sure that you're not a robot. So if you, I think that there'll be an automatic pop-up for you to do that. And if you could verify and complete the subscription, that way you'll be able to get updates on stuff as I post them, or if others ask me to post blog updates on events or upcoming events, upcoming events or any kind of other information that we want to share across our network. And then finally, our next learning opportunity is going to be on a Monday. As you may remember, we're going to switch off between Mondays and Wednesdays, mornings and afternoons, because then we'll be able to have more of our network members participate, especially those who may have standing meetings on a regular basis. Again, we're going to focus on policy in February. The advisory team decided to push back the focus on data to March and do another session on policy, just because we will still be in legislative sessions and there's a lot going on. I have invited someone from the Network for Public Health Law to present on the resources that they may be able to provide to us as injury and violence prevention practitioners and researchers. And I also wrote to a contact at the National Conference for State Legislators, and we'll see if they're available to present. But so far confirmed, we definitely have someone from the Network for Public Health Law who will be joining us. And then hopefully we'll have a little bit more time to talk about, again, what's coming up in our legislative sessions and some peer learning and discussion with each other. So with that, that ends our learning opportunities month, unless anybody has anything else they want to share in our last minute here. And as always, we'll post the recording on our website as well, so that'll be available. Okay. Big thank you again to Paul, Anna, and Anne. Thank you so much for participating and sharing your experiences on the call today. That was really helpful to hear. And I will talk to you all next month. Bye.
Thank you. Thank you.
Yeah,
thank you.